Hi, this video is about cocaine addiction help. If you have a loved one addicted to cocaine and needs treatment, we want to talk to you today about getting them help with the intervention. My name is Bobby Newman. I am a certified intervention professional and an internationally certified drug and alcohol counselor. I've helped hundreds of people get into treatment over the years, and after overcoming my own battle with addiction nearly 20 years ago. Today I want to talk to you about cocaine and intervention help with cocaine addiction. The overdose rates for cocaine is such a concern today simply because Colombian drug cartels are hitting highest ever numbers. More people are overdosing on cocaine than ever before. The cost of cocaine has gone down and the purity levels have gone up, increasing the chances of addiction as well as making it more available to the American public. More and more people are mixing cocaine with heroin and other opiates such as fentanyl, which also increases the chances of overdose. Over 70,000 people overdosed in 2018. 1/3 of those were attributed to cocaine addiction. And again, there's a thing called what we call a speedball, which is heroin and cocaine being mixed together and injected. This all increases the chance of overdose as well as increases the chances of addiction. And more people, it's more and more prevalent in today's time. So it's a very big concern. People that are familiar with cocaine addicts and their behavior can actually use the addiction and the effects of the drug to their advantage. And a professional interventionist is going to know that the cocaine addict is going to be very chaotic, going to be very volatile, there's going to be a certain amount of psychosis due to the lack of sleep and the lack of food and proper nutrition. But they can also use that to the person's advantage because the drug is going to have the desired effect for a certain period of time, and then after a while that effect is not going to be as powerful and the person's going to come down. Eventually the person's going to have to get some food, eventually they're going to have to get some sleep. A professional interventionist should be able to do his best to time that to where he can use that to his advantage. I actually have an example of that. A few months ago I had a girl that was out in the Virginia area. She was a very high functioning addict, very intelligent person, but was highly addicted to cocaine. And I'd gotten together with her family to plan the intervention, and we found out the night before that she had been up all night and hadn't slept in probably maybe even close to 2 days. So her sanity was going to be pretty much in question. So I decided to wait a day. I thought, you know what, I'm going to see it. She's got to eventually come down, in our best interest, in her best interest, to get some sleep. So we waited an extra day and we went back in the next morning, and she was more susceptible and accepting of talking to us. She was, when a person gets really high on a drug, when they come off of it, it has the exact opposite effect. We call that the pendulum swing, back and forth. She gets really high and then she comes down and she gets really low, and that's when we went in to talk to her. And it was what we call, she was very griefy and but also willing to talk and actually more accepting of needing to change her life at that moment versus being high on the drug. We ended up getting her in treatment that day after her telling us that she couldn't go to treatment probably that day, probably at least 50 times. We ended up a few hours later getting her agreement, and I got her on a plane that night. But it was all due to the timing and using the negative effects of the drug to our advantage. I wanted to bring this to your attention about cocaine addiction and getting cocaine addiction help. And also I want to offer you guys something. If you'll click in the link below, down in the description of this video, there's a 25 tips to a successful intervention. These are in sequence, a series of tips that you should take to actually get your loved one into treatment. It's very effective. And if you click on the link, fill out the form, and request the 25 tips to a successful intervention, I'll also send you the art of the intervention, which is a 37-page guide that not only talks about what to do during an intervention, but it also talks about what to do when the person enters treatment, what to do when the person completes the treatment program and comes home. It also includes a consultation with me. We can actually put together a plan to help you get your loved one into treatment. I want to encourage you to click on the link below, fill out the form, or give us a call. You can call us at the number on the screen, 866-989-4499. You can also, I encourage you to subscribe to our channel, because we will be coming out with weekly blog posts and videos concerning various drugs of addiction. And if you'd like to learn more about cocaine addiction and how to get intervention help with cocaine addiction, please give us a call, 866-989-4499. Thank you.